Hello, student instructor Pamela here, and welcome to your week 5 discussion forum feedback. And this week we focused on your CMAA certification or your medical assistant certification. Keep in mind that depending who you get your certification with, that you will have fees. For example, some organizations, they may have a free retake if you are unsuccessful for your first attempt, or you may have to pay again. Either way, all of this information is communicated within the website that you are going to take your medical assistant certification. Also keep in mind that your medical certification has a combination of multiple choice and essay. So again, you want to ensure that you implement your process of elimination during your multiple choice questions, meaning you always want to choose an answer, whether if it's by guessing, because you have a 50-50 chance of getting the question right. Never leave a question blank. Also, we discussed a little bit of what's going to happen during your interviews when you are going for your jobs. So during your interview conversation with the hiring manager, you want to display the knowledge of the revenue cycle in general. You want to be able to communicate that you understand that the life cycle of a claim is imperative for both clinical and non-clinical staff. It doesn't matter if you're a doctor, if you're a scheduler, if you're a medical assistant, if you're a coder. It doesn't matter. Our main objective is, of course, is always to provide patient care and to ensure the patient is taken care of, and then getting the claim paid. That's what keeps all of the facilities up and running. So to be able to communicate this information during your interview, of understanding how scheduling works, how the check-in process works, checkout process works, insurance verification, the coding, also again performing your particular tasks as a medical assistant, and how the bills are actually submitted for review, and how the bills come back, and how the payments are posted, and how the collections work. I know it sounds like a lot of steps within the revenue cycle, but really it all makes sense. Again, the claim needs to be reviewed and submitted, and in order for us to get reimbursed. And then, of course, the patient's chart is updated, the money is posted, and then we're able to move on to the next patient. But always keep in mind that when you're in your interviews, you want to be able to communicate that you understand functionalities of how to get the claim paid, because you're never going to know if your facility that you're working with, if they need you to step in or help or intervene if somebody's on vacation, or again, just being cross-trained overall. So a couple other tips for when you are preparing to sit for your certification: make sure that you purchase the exam review guide from the actual organization that you are sitting for, because they are going to give you how the test is going to be presented to you on the day that you sit for it. And always keep calm. Again, implement your process of elimination, and you will do just fine as you've been doing thus far in this course. And again, this is our last week together, so congratulations on the hard work that you have dedicated to yourself with your education, as well as becoming a healthcare advocate and professional. So until next time, Instructor Pamela here. Continue to journey well, and go ahead and be an awesome sauce healthcare beast that you are. And good luck on your exam. Until next time, Instructor Pamela here. Journey well. Bye-bye.